pulmonologist told me about it, and he was looking into it and explained to me what it was. It was a trial procedure about where they were going to go to have it done, and then they do the PFTs and to see where you're at. You know, if you're too far off the scale, they're not going to.
There's a criteria.
Exactly.
I honestly had done no research on Dr. Martin. You know, I met him and I said, okay, going through it. But I did write a note and I gave it to him before the procedure. I said, I've done no research. I need to wake up. And if I don't, I'm going to haunt you. So make sure I wake up, make sure I can play tennis. And that was it, you know. And I gave that to him before it.
I read the booklet and then I went in and talked to my pulmonologist. He didn't know much about it, and he didn't have anybody that had had this done. He had heard about it, but he didn't know a lot about it. And I'm the only patient he has that's ever had it done, and he's absolutely amazed. So, and he's spoken to Dr. Martin, and he's really impressed.
Dr. Breen was excited about it. He says, you know, I'd like to see this get done. And I guess he got in touch with Dr. Martin because next thing he's saying, well, what about the board? Would you have any objections? I said, I don't care. I mean, at this point, I gotta do something.
I was just excited when Rob and Lucas told me about it. And I was like, I hope I'm a candidate and can get off the prednisone. That was my main thing. So happy to try. You know, you get to a point when you're just happy to try anything.
Yeah.
Yeah. So came here, and like I said, I didn't do any research or anything. I was like,
I guess you get to that point, it can't get any
do
worse. It can only
anything.
get better.
Exactly.
Yeah.
Do anything, and I'm happy.
It's got to
with
go
it.
up. It can't go
Yeah.
back down. The first procedure was a little trying because I had no idea what I was getting into. I had no idea what the outcome would be, but I really didn't have any bad days after each of the procedures.
When I first went in, I had no idea what I was getting into. But you're at the point where this is it. You know, I can't keep on doing what I'm doing, and medicine-wise. First day afterwards, it was a little rough. You're, you know, kicking up a little blood because they're moving the junk around. When the second procedure it was always like the first day after that you're getting all like a little bit of mucus and getting rid of that. Third was the same way. And then right after that, a couple months, I'd seen the pulmonologist and did the PFT, and like I say, when he bounced it up 10 points on me, that was great for me. I mean, that was, so.
No pain, other than the first night I was tired, and you know, I just felt a little sore. My throat was a little sore and all, but I had no pain, and the next day I felt great.
I was fine. I had a little bit of, you know, you have a bit of sensitivity in the middle when you wake up, but I loved the anesthesia. And I remember Beverly used to say, you have to start walking. I said, just leave me to sleep. But when I went back home, I did have, you know, a rough time. I think for about 2 weeks. I was on steroids and really chesty and wheezy. And then, you know, I have a week off it. And I'd say, okay, let's do it. I'm fine. Let's just go for the next one. I just wanted to finish all three.
Yeah.
And after the third one again, so I was on the prednisone for a few weeks. And then I was just fine. Absolutely fine, yeah. So I'm really amazed.
You get in a bad situation, you take the prednisone. The prednisone helps you. Now the problem is you start eating too much. Now you're putting on the weight, and that seems like to pull down your lungs, and it's like a vicious circle.
Well, the other problem with the prednisone or steroids is it makes your blood sugars go up. Diabetes related to the steroids. So when I was in the hospital, my blood sugars were all over the place, and I'm getting shots of insulin, and I'm thinking, well, this is crazy. But when I went home and I wasn't on it anymore, I was fine.
Yeah, you don't feel psychotic anymore.
I would recommend this to anybody who has severe asthma to look into it and get it done.
Nice to see you
How are
again. Okay. You're still feeling better?
Yes, sir.
Great. Feeling great.
Thanks to
Very
you.
good. Very good. Well, thank you so much for coming in.